I am Dr. Ashutosh Misra, plastic surgeon at Beaumont Clinic, New Delhi. Today we will be talking about a very common problem which is a double chin. डबल चिन जो है वो यंग एज से 18-20 साल से लेके 50-60 साल के लोगों को इफेक्ट करती है. सो गेटिंग इनटू द फंडामेंटल्स ऑफ डबल चिन कि भाई डबल चिन हो क्यों जाता है. तो देयर आर कंपोनेंट्स इन आवर नेक. सबसे ऊपर है स्किन, उसके नीचे आता है हमारा फैट, उसके नीचे आता है हमारा मसल्स, उसके नीचे फिर आता है फैट. सो इट इज वेरी इंपॉर्टेंट टू फर्स्ट सी and get an idea where your fat is, why you are getting the double chin. इसके सर्जिकल और नॉन सर्जिकल दोनों ही ऑप्शंस होते हैं. किसके लिए क्या चीज इंपॉर्टेंट है वो ट्रीट करेंगे, यू विल गेट द बेस्ट रिजल्ट्स. इट्स नॉट दैट कि आई वांट टू गो ओनली विद नॉन सर्जिकल थिंग्स और आई वांट टू गो ओनली विद द सर्जिकल थिंग्स. नो, you have to select your candidates. Now, coming on to non-surgical options of double chin. So, non-surgical options may contain, like if you have only laxity of skin, no fat, then radiofrequency, fillers, threads, they are the main treatment source that we can use. The other things, like if you have laxity of skin and also fat, then we can use some chemicals that can dissolve the fat. Commonly, it comes by the trade name of Kybella. We can use that. Then there are certain machines like microneedling with RF. That machine can be used for skin tightening as well as slight amount of superficial fat reduction. We can use ultrasonic therapy to reduce the fat which is here, the submental fat, and also we can freeze our fat by different machines that can freeze the fat and then it is dissolved and taken. So these are the non-surgical options. Now selection of patient is very important. If I choose a wrong method, you won't get the desired result. And now if there is a lot of laxity of the skin and a lot of fat that has to be removed and we want that fat to be removed evenly, then there are surgical procedures for that. The most common is doing an energy-based liposuction, which we call it as a very commonly used machine is Vaser liposuction. It has two components. It has energy as well as it removes the fat. With the energy, it melts the fat. It also improves upon the quality of your skin from inside. So it causes skin tightening as well. So large amount of fat, it has to be a surgical process. If now there is even laxity of the muscle out here, then we need to tighten up that muscle. That means we have to add with energy-based devices or a Vaser liposuction, we have to add muscle tightening as well. For this, what we do is we take a small nick here, go inside, remove the excess fat, and we close the muscles. We tighten up the muscles, and it gives a very good V shape. If in an age group plus 50, and there is a lot of laxity, hanging down skin, hanging down muscle, then there is a term called platysmoplasty or a neck lift procedure. Again, we have to lift this neck from here or from the side, and it can be combined with face lifts. So face and neck lift combined, that will give a very good contour of the neck. Now if we want to talk one by one about the benefits and the side effects of these things. Now limitations of non-surgical procedures. Say start with a young patient comes to you, very small double chin hair, and doesn't want to go for any invasive procedure. Then this fat dissolving chemicals we can inject. It has to be very meticulous, and then there are certain exercises that have to be followed, and then certain machines for distribution of that particular drug. It gives a good result, but then the area should be very small. The limitation is very small amount of double chin fat. Now if there is the problem only with the skin, loose skin, fat is not there, loose skin, mild wrinkles, it can be taken care with the help of either botulinum toxin or the use of threads as well. Everything has advantage and disadvantage. Most of these non-surgical things are temporary. Now the botulinum toxin acts only for around 4 months, decreases by 6 months, and it has to be repeated again. Threads, they tighten up the skin, but the problem is when you tighten the skin, there is a bunch of skin that will come out here in the hidden area. That will stay for some time, and when it becomes loose, that means you have lost whatever you have gained. So this is also very temporary, but it may last for around 8-9 months. Plus threads also causes collagen formation in the skin. So long-term use and repeated use of these threads and botulinum toxin may cause improvement in skin as well. So repeated use will decrease the quantity of threads, decrease the quantity of botulinum toxin that has to be used. So it is more of a regenerative medicine, I call it. It has to be a continuous process. Not an immediate change, but a continuous process. Now, fillers also are very important, especially in mid-age, plus 30s, 40s. At that time, there is loss of our fat because of the aging process. There is loss of our fat, and then what we can do is we can put on the fillers in the jawline. This will replenish whatever loss which is there and tighten up the skin. So again, this is a good thing for mild amount of neck looseness or neck fat to flatten it out, get a good angle here. Fillers are also temporary, but they may last for around a year's time. If the laxity is too much. Now coming on again to the machines first. So the machines, micro needling and MNRF is a very good in trends today. But what they can do, they are more consistent in improving the quality of your skin. What we practice, if you have more amount of fat, then that doesn't work good. Then it has to be something which penetrates more deep inside. Then we can use more deep radio frequency devices or an ultrasonic devices which can melt the inside fat, and radio frequency a combination to improve upon the outer skin as well. But again, the limitations are machines can do a very limited work. So your expectation should be very important. What type of fat you have, what type of double chin you have, then only you can go for it. Now, if your double chin is because of your retrusion of the chin, then nothing will work except for chin augmentation, because this retrusion of chin is causing hanging of this neck skin. We put on something here, it will give a good contour. So assessment is very important. You have to go to your doctor for the assessment. What method is best for you? So he'll assess and he'll advise you these methods. So overall, choosing your doctor is very important. He should be a very experienced plastic surgeon. He should address your problem. He should look into where your problem lies, and the treatment is according to that. You cannot just go and say, I don't want to go for a surgery, or I want only Botox for doing this. Then you might not get your desired result. Let your doctor choose what procedure is good for you, and he'll guide you with that. So in this video, I have tried to explain the various things that we can do for double chin. और मुझे उम्मीद है कि आपको ये सब समझ में आया होगा. इसके बावजूद अगर आपके कोई डाउट्स हैं, कोई क्वेरीज हैं, यू कैन DM मी, और नीचे आप क्वेरीज और क्वेश्चंस पूछ सकते हैं. वी विल आंसर दैट, एंड होपफुली इफ with that query we can make a new video especially for that query for you. Thank you.